Claire, thank you very much. Good morning. My name is Rich Connect. I'm one of a small handful of advisory committee members here at Breaking Barriers and would add my 2 words of welcome for you this morning. If you were here with us yesterday, we began to explore shared leadership as one of 4 pillars to whole child, whole student work, and we're going to spend a little more time this morning talking about that. In order to do that effectively, we need to understand the context and the landscape for the reform effort here in California. It's my pleasure to introduce our first 2 speakers, presenters this morning, who are going to do that contextual piece for us and help us get ready to have a further exploration into what it means to share governance and share decision-making and share responsibility with one another. So please welcome Dr. Sohil Sood. Some of you met him yesterday. He joined the Children and Youth Behavioral Health Initiative in January 2024 as its director. He's a hospital-based pediatrician, associate professor at UCSF, and a father of 2 children in California's public schools. His background combines a commitment to service, long-standing clinical experience, and collaborative health policy work. He'll be joined here shortly by Stephanie Houston, who is an assistant superintendent of the Innovation and Engagement at San Bernardino County Superintendent of Schools, where she also serves as the trustee chair for the San Bernardino Community College District. She served for 12 years as a superintendent of the Colton Redlands Yucaipa Regional Occupational Program. And Stephanie is also a commissioner for the Council on Occupational Education, where she reviews and recommends accreditation status for approximately 600 post-secondary institutions nationwide and abroad. Please welcome Sohil and Stephanie.
All right. Good morning, folks. How are we doing? All right. Can we give it up one more time for Claire? She's amazing. I don't know how old she is. I'm not going to, she actually said it. Yes, she is more than half my age and far more intelligent, far more poignant, far more inspiring, far more capable than I am. So thank you, Claire, for your wise words here. I spoke yesterday here, and if you were there or if you've ever seen me present, I go through the Children and Youth Behavioral Health Initiative with this slide deck here. But I think for the purposes of time, I'm gonna fast forward all the way right to this one here. So as a very brief overview, this is a multi-billion-dollar, multi-year effort to transform the way we support our children, our youth, and families. And the approach here is to meet kids and families where their lives play out, right? That includes the doctor's office, it includes the healthcare setting, but it includes homes, it includes schools, it includes communities, it includes the digital space. And it really is only going to be possible if we hold youth at the center, if we keep equity as foundational, if we're prevention-oriented, if we don't just focus on the crisis, and if we work together. Because this is going to fail if they live as separate bullet points on a PowerPoint slide, right? This is so important and yet so hard to do in so many different respects. And so just to walk through that path a little bit further here, I don't quite know, I will be honest, how to break barriers. But I'm here to learn, and I'm here to listen with all of you. What I have learned in my short time is through the mistakes that I've made. And so I'm going to spend a few minutes walking through those mistakes, just to be vulnerable and transparent, and then hopefully we can all learn together. So if you want to build these beautiful, strong walls in between the various institutions that need to work together, you need to assume that the other that you're working with is a monolith, right? Richard mentioned, I've got kids in California public schools. I grew up in California in the public school system. So that means I know everything about California public schools, right? It turns out that my experience was my experience. Oops, sorry. And that everyone's experience, every school, every institution is different, right? At that specific local level. Every county is different. I've had the good fortune of traveling to many counties throughout the past few months even, and I've seen just the beautiful diversity of this state. But that means different resources, different connections, and different people. And I think we do this as institutions. We stereotype one another. And then we also do this as professions. So raise your hands if you've ever said, perhaps to a friend, so you're a doctor, so you must know. And then shown a rash, some sort. Yeah. It turns out all doctors aren't dermatologists. It turns out all teachers don't teach the same age, right? It turns out all probation officers don't think the same. It turns out all those in the foster care system don't have the same experience. And I've walked into so many meetings with a preconceived mindset that I think has clouded my ability to listen really well. So this is one takeaway. Another one that I think we're really good at is we really know how to characterize problems, right? Like, why don't we integrate well? Well, because funding is siloed. Oh, that's a good point. Why don't we integrate well? Oh, because legislation occurs in piecemeal ways. Oh, that's a really good point too. Oh, our cultures are different. Our vocabulary is different. Oh, really good points. Geographically, oh, you're in this building, and oh, we're 5 miles away in the other building, so we never cross paths. Oh, really good point. Oh, looks like the meeting's over. And then we go our separate ways, right? And so I have noticed, at least, that root cause analyses, understanding the context of the problem is so important, but sometimes solutions don't match cleanly onto that, right? The pragmatic aspects, the unexpected aspects come into play here, and we have to move beyond just understanding the problem, but moving toward the solution. Our youth who were here yesterday charged us to act, and that involves moving into vulnerable spaces. We often agree on the problem and disagree on the solution, so it's a harder space to work in, but I think we need to wrestle and work through that. Another piece, and this is more directed at me and those in my profession, is sometimes we think health is the most important thing in life, and actually it may be true. My father passed away with cancer, and the day before to the day after he was diagnosed changed our lives. Those with serious mental illness, the day before and the day after a diagnosis of psychosis, of serious depression, anxiety, is life-changing. But I think oftentimes when we say this, as the health profession, we actually mean this. And this, I don't know if this is true, right? Health care isn't health. It's part of it, absolutely. But some of the studies and statistics that have looked at what determines our health show that healthcare is maybe 16 to 20% of the picture. It's income, it's education, it's community, it's all of these other facets. And so I'm giving you permission to push back on us. If we say the solution is only another psychiatrist, or if it's only another building or residential treatment center, absolutely, those are important parts of it, and we don't have enough of it. But I'm proud of this initiative in the approach it's taking, again, of meeting all of the other segments of life where we live. And the final thing I'll raise is the real experts in the room. Sorry to say they were here yesterday. And one of them, a youth fellow, was on this podium yesterday, and she said to everyone in this room, and she's been in meetings with me many a time, and she said, sometimes they feel like a social club. And that stung, right? I don't think any of us who are in those meetings, and I've been in many of those meetings with many of you, ever want to feel that way, right? It's okay to smile and enjoy and to work with our colleagues, but it has to feel productive and it has to feel inclusive. And I don't know if that's what I would define a social club to be. So I think we have to take that to heart. We have to do everything that Claire mentioned, that Elizabeth mentioned, of really opening our doors, thinking more broadly and thinking more expansively, because otherwise we're going to continue with these huge brick walls. Now I have the honor of passing it over to a dear friend and colleague, Dr. Stephanie Houston, from local education, right? I'm state health, local education. We're on the same stage together, so we're making some progress here. To really think through how do we transform together. We're partnering in many different respects, but also in particularly to bring our sectors together and to work through this. And Stephanie's going to talk a little bit more about the great work that's happening in San Bernardino County overall, and then also to support this initiative. So thank you.
Well, thank you. I'm hoping that this will be one of those moments where how many years of education does it take to figure out how to use the clicker? Maybe more than I have. I'm hoping not to be tethered. Oh, there we go. Okay. All right. So thank you for the introduction. I am so excited to be here, but I'm going to take you to school. So just know that. And as Dr. Sood said, we've all been to school, so we know how to run school, right? So, okay. So I want to talk first a little bit about where I come from. So San Bernardino County, what is it? Well, it is the largest county in the contiguous United States. We are over 20,000 square miles. We are a region of regions. The petri dish that is San Bernardino County, you can see some of the statistics that are there, but we have districts that range in size from 100 students to well over 45,000 students. The 8th largest district in the state of California is San Bernardino City Unified School District. That's who we are. We also have 51 charter schools. It's a big area. We go to the next slide. It's going to give you a little bit more information about who we are. You can see almost 400,000 students, almost 20,000 teachers, almost 600 schools. And you can see the breakdown there. We'll go to the next slide. Here's the ethnicity, the breakdown there. You can see we are primarily Latinx. You can see we are majority minority as a county. We'll go to the next slide. So with that, why am I here? Why is a county here to talk to you? Why is someone representing a county office of education here to talk to you? So making it real. There are some assumptions that, this is my opinion, this is not research-based, but my assumption is that these historic investments are coming to and through county offices of education because we have a unique vantage point that is a statutory requirement within the system that we're trying to change. And you can see some of those statutory requirements around what do we chase, what we're accountable for, and what we're funded for. So the system is designed to do exactly what it's doing. We've been talking about that for the last day and change this morning. But we have this unique perspective in county offices to review how the funding is going and what districts are saying are their priorities, what they're accountable for. So we have this unique position. So through that position, we have a system. If we go to the next slide, this is how our system in California of accountability and funding, again, we chase what we're funded for and we chase what we're accountable for. Local control. We all have local control now in our districts. Isn't that an amazing thing? So if you look at that truck right there, local control was legislated in 2013. So we're a little over a decade into local control. And it was the idea that districts, communities are closest to what their needs are. Novel thought, kind of what we've been talking about, kind of what we want to do. So tell your story, districts. Use your funding and tell your story. And that's really what local control was about. That's what our local control accountability plan was all about. And it was beautiful. It was 12 pages of loveliness. You can see over the years everything that's been added in terms of statutory requirements related to how a district has to validate their priorities. And the weight of that is where we are today. That's the weight of what has been added to the plates of districts that we're needing to be part of this huge system are dealing with. We'll go to the next slide. So in San Bernardino County, because we have this unique perspective, we are reviewing statutorily, as every county office is reviewing statutorily, not only the funding, but the priorities. These are the 5 priorities for the next cycle of accountability. You can see where all of this work intersects what we're talking about. So this is a snapshot. This is San Bernardino County. This is the 33 districts. Overall, these are the themes that have lifted out. So when we talk about integration and we talk about the importance of integration, you can see where all of our work, our community work, our cross-sector work intersects here. We go to the next slide. So with that, we have a system in California system of support. And you can see there are 3 tiers: support for all, support for some, support for an even smaller number. That's what we have in California. That's what the county offices of education have, this view and then this requirement to support. So we go to the next slide. Within our systems of support, that level 2, that tier 2, is called differentiated assistance. I'm taking you to school fast because I'm trying to get you somewhere else. But I just want to give you a little bit of context. So differentiated assistance is a requirement of county offices of education to provide to districts who aren't performing the way the system wants them to perform. Go to the next slide. So this is how you become eligible. This is in education code. This is statute. This is the law, right? You can see if you're 2 cycles, every year we have what we're accountable for, our California dashboard. And on the dashboard, that's where those decision points are. That's where a district will fall into needing this level 2 support. If we go to the next slide, you can see the priorities for the dashboard release, which is coming up in a couple of weeks. There's a tiny little pucker factor. You can laugh. Going on right now. All right, here's more statutory responsibilities. We're going to click to the next slide. So what the heck are we doing in San Bernardino County? So understanding our role that's required by law, we're really working hard to ensure the left hand and the right hand within the County Office of Education knows what each other is doing. For those of you who are in the room who are from a County Office of Education, does that sound like an easy task? Kind of really, really hard. So the branch that I lead, we can have a single department within the branch where the left hand and the right hand don't know what they're doing, right? And then when you layer on multiple branches and HR and business services and student services and all the things, trying to figure that out is really a tall order. So when we say this work is hard, within a county office structure, it's hard. Within one of our governmental entities, it's hard. This is the graphic of what we've put together. Click to the next slide. What does that look like? So here's what we did in 2024. Collectively, across all of our branches, we were able to implement our differentiated assistance in an integrated way, really for the first time ever. Going to go to the next slide. What does that mean? You can see where we have different, we call them branches, divisions, whatever, within county office, and who and how we were calling on our superintendent's office, our innovation and engagement, our HR team, our SELPA teams, our education support services teams together. It's the Christmas miracle. I'm not even kidding. And again, for those of you in a county office, I don't think I'm overstating that it's a Christmas miracle that we're able to do this work together. We'll go to the next slide. So what does that look like? One system is what we're looking at. So we're focusing in San Bernardino County on these historic investments around community engagement, around community schools, around CYBHI, and around universal pre-K. That's where we're starting. Is that all of it? Absolutely not. There's so much more. But if we can start there and then grow from there, we think we're on the right track. We go to the next slide. So what does that mean in terms of the investments around CYBHI? Where you see the red circles, that's where San Bernardino County Office of Education is supporting districts in those specific work streams. And you'll see at the bottom I added a work stream called Transforming Together. Transforming Together is really a petri dish, if you will, a learning lab, if you will, with 4 pilot county offices. Not San Bernardino County is not one of those 4 pilots. To really, let's learn what's happening in other parts of the state around this integration of investments of CYBHI and community schools. If we go to the next slide. So this is what Transforming Together is all about. The integration of proof of concept of how CYBHI and community schools, when built together with intention, can really be so much stronger than the sum of the individual parts. So my dissertation is on collective impact. So I truly believe, I am not a math major, but I truly believe that 1 + 1 + 1 = 47. And that's what we're trying to get to. Like that we're greater than the sum of all of our parts. So we go to the next slide. I'm sorry, I'm going really fast. All grounded in the work that you know. All grounded in the work that started in this room. That starts with our youth. That starts with what we heard yesterday about ensuring that we engage with our community to remove barriers and make a difference in the classroom. At the end of the day, that's our work. And it takes all of us to do that. We've got our community schools partnership program as well, another historic investment. So there are so many parallels. So what I'm trying to help you see is that we've got some statutory requirements at a county office. We've got some investments going on. We've got the perspective to be able to align those investments and see that we're not adding anything, we're integrating. We're not doing more. We're working around efficiencies to use what we have to really change the system. How many of you have ever said, gosh, I would love to do that if we only had the funding? Like, you can, could be the call and response part, right? I would love to do that if I only had the funding. We have the funding. We have the funding. We have permission. Next slide. So within the county office structure, we have our state leads. We have our regional leads. That's a structure, one state lead. Our partners at Alameda County are just, I mean, they were put in a really impossible position of, okay, take this investment and make it work. And then we have our regional leads, another impossible task, 8 regions within the state. Okay, take this investment and make it work. And we're doing it. We're doing it. Is it perfect? Nope. Is it going to be an iterative process? You bet. So for those educators in the room, right, we all know about science. We all know about making mistakes. Like that's actually, you have a hypothesis and you're testing your hypothesis, right? It's all about making mistakes and learning from your mistakes. But the art is knowing the mistakes to keep. And that's where we are within our state system, our regional system of support for community schools. Well, then next slide. Sorry, I'm trying to go really fast. We have a really short time. Next slide. Next slide. Thank you. So later on, I'm sorry to be so bossy. Oh my gosh, I'm so sorry. I'm so sorry. I shouldn't be so bossy with you. I'm in trouble. So then when we layer on the larger, okay, so that was just county offices of education. Holy shnikes. Whew. Now let's talk about county big, what I call county big, those county office structures. What's legislated there around our system of care that's grounded in this integrated core practice model? Oh, okay, we're gonna do that too. Remember when I said we don't even know left hand, right hand within one tiny little department that does like tobacco use prevention education? Like, is it really hard? Oh, you were there? I didn't even know you were there. How come we weren't talking about you being there? Oh my goodness sakes. Like, meh, super narrow. Oh, okay, now we're gonna bring in big government and we're gonna have this agreement, which we do. It's understanding that we have all of these layers and all of this opportunity through these layers. We're drowning in frameworks. We're hemorrhaging systems, right? Pick and choose what's gonna work. Let's chase what works, right? Okay, so, last slide. Yay, aren't you glad? So, and I made this super small so that you couldn't read it. So I could just say whatever I want about it and you'll have to believe me. So here's how we do this. Like, it's all great. We were talking about we can talk a good game. We're all talking. How do we actually walk the talk? This is what it looks like in action. And actually what this slide lays out is sort of like that vision, which is in the very first column. And then what are some of our drivers? So like some of the statutory pieces that we have. What other like partners do we have? And you can see CEI, CYBHI, all the acronyms are there. All of our partners are there. We have a county-wide gangs and drugs task force that's there, a county-wide gangs and drugs task force. We have our interagency leadership team there. It's all there. So then what are we doing? What's the actual action? That's the last column, right? Sharing data. Ensuring that we have regional youth and family voice across all of this. We're looking at innovative staffing models. What? Change the job of teacher so that it's actually something that people want to do? Huh! Shocking. One teacher, all things to all students all the time? We heard from Dr. Sohil, he doesn't know anything about rashes. Don't ask him about a rash. Just because he's a doctor, don't ask him about a rash. Well, guess what? Because I'm not, but if I were an elementary teacher, like, don't ask me about what's happening in high school. Don't ask me about a career pathway. Don't ask me about food insecurity. All things to all people. Our teachers are leaving the profession. So how do we honor and wrap diversity of experience and distributed expertise? Don't vote me off the island. Without a credential? What? How do we do that? How do we do that? That's system transformation. It all counts. We heard from our youth. They have diversity of experience. They have expertise. Their parents have expertise, diversity of experience. Imagine if we had our teacher and we wrapped that around our teacher so the teacher doesn't have to know about rashes. But we have people that do know about the rash. That's part of the system. That's part of the team. So when we talk about innovative staffing models, that's what we're talking about. Safe routes to school. I always say, oh, system transformation, let's talk about the elephant in the room. Transportation, CIF, and collective bargaining. Yes, I said it. Safe routes to school matter. How do we get our transportation partners here? Part of the conversation. And then you can see our school-based health and wellness centers. So that's how we're doing it. So I don't know where we are in time. I went really, 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 really fast. But I have 5 minutes? Okay. Oh, look at that. Look at me go. Okay, so I wanted to, I wrote down some notes. And I know I have to put my glasses on because, from yesterday. So yesterday, when our students were talking and when we had the presentations, there were some things that popped that I wanted to just tell you about some of the things that we're doing in San Bernardino County, like some more actions, more than what's on there. So one thing that we're doing is working through our countywide gangs and drugs task force. And our countywide gangs and drugs task force includes all of our electeds within the county. So our county sheriff, our county district attorney, our county superintendent, and then a variety of other elected officials, including assembly members and senators within the local or from our local area, school board members, community college trustees. That would be me. But one of the results of that is that our county district attorney has developed a civil liberties curriculum that is being delivered by his team to students who are justice involved, so that they understand what their rights are, coming straight from the people who will prosecute them. Think about that for a minute. The people who will prosecute are telling the students, here are your rights. Know your rights so that you don't ever end up in a situation where you're in our courtroom. A civil liberties curriculum. It's pretty cool, and no one else is doing it. We heard yesterday about pay the kids, pay the students. It's really important. We got, write the check. I heard that. I was like, yep, wrote that down. Guess what we're doing? We're writing the checks. We're writing the checks. We're writing the checks. But beyond writing the checks, we're taking a systems approach, because it's not enough to write the checks. You have to be able to cash the check without having a huge fee. So many of our students are not in a position where they can open up a check. They legally cannot open a check. They don't have a guardian. They don't have the documentation that they need. Guess what we're doing? We're working with a credit union who has committed to a HOPE account. It's called a HOPE account. ThinkWise Credit Union within San Bernardino County will open up an account for all of our students so that they don't have to go to the check cashing place and lose 30% of their check, right? HOPE account. Hit me up. I'll tell you all about it. So yeah, we're paying them, but it's really, really expensive to be poor. Super expensive. And when I say that, like the cost, our health costs, the social determinants of health, the actual, like, I can't cash a check without giving you 30% of it, right? That's really, like, we're talking about systems. The other thing is that, so we do pay the students. So we do have a job description that is our peer leader associate. We pay them, we hire them. We have within county offices, probably some of you in county offices have a student worker kind of a setup, maybe. We have student workers, we've had student workers for decades. This is an extension of that. And within the job description, the minimum qualifications, lived experience in the foster care system and or lived experience as being unhoused. That's a minimum qualification to be hired as a peer associate. And the last thing I'll talk about is CalFresh on college campuses. So we were able to be part of and implement and within our region have one of our assembly members carry the legislation that now allows for effective January 1. Our students can access, oh, that's my timer. I did it. Sorry. Can access CalFresh on their college campuses. So thank you, we're doing it. We're doing some things. Thank you.